Authority Chief Executive Officer Elijah Wachira has been sent on compulsory leave to allow investigations into his conduct and performance at the helm of the authority. This according to SHA Chairman Dr. Abdi Mohammed, who says that Wachira will be away for 90 days so as to allow for the probe. Robert Ngasira, who has been serving as the Director of Financial Services at the state-owned insurer, has been appointed acting CEO. Ibrahim Karanja with the inside story on what Wachira faces as allegations against him, which led to a lengthy defining board meeting this evening.
The bumpy and troubled road to a fully and effectively functioning universal healthcare system under the Social Health Authority now seems to be eating up those perceived to stand on its way 42 days into its national rollout. Acting Social Health Authority CEO Elijah Wachira is the first executive casualty. After hours of a board meeting that also involved officials from the Ministry of Health, the Dr. Abdi Mohammed-led board resolved to send Wachira home over what is alleged as bungling up the transition process from NHIF to the Social Health Authority and sabotaging payment to providers even when money was available. The past 42 days under the Social Health Authority have been a thorn in the flesh for many patients, some of whom were denied or received delayed healthcare services through the comprehensive three-tier social health insurance framework, which are the Primary Healthcare Fund, the Social Health Insurance Fund, and the Emergency, Chronic and Critical Illness Fund. Sources indicate that the board is partly blaming Wachira for this, alleging that he diverted resources to a tune of 1.6 billion shillings earmarked for offsetting debt to public facilities, almost leading to paralysis of healthcare on account of pending bills. They allege that monies were channeled to private hospitals, which despite being owed by government, were not yet due for payment. The board further claims that there might have been kickbacks involved to effect this. Robert Ngasira now takes over as acting CEO in the 90 days. Ngasira joined the NHIF at the same time as Dr. Wachira in 2023, when the team led by then acting CEO Dr. Samson Kuhora exited. But as things got heated up at the Upper Hill-based SHA offices not too far away at Parliament buildings, the National Assembly was also reflecting on the frustrating confusion around the 42-day-old social health insurance. Rangwe Member of Parliament Lillian Gogo brought the subject to the fore with an adjournment motion, opening the floodgates of outpouring concerns from members.
I think we are taking Kenyans for granted, Honorable Speaker. Honorable Speaker, I think we are also creating unnecessary positions to benefit those who are elite in our community.
There are those who, however, defended the system, saying it is best for the country.
Parliament saying that they do not know the difference between chief and chiefo. Yet you are seated in this house, you legislated right from the first reading to the third reading to the committee of the whole house. You are here shouting aye, as the speaker said, the ayes have it. Then you go to your village to tell Kenyans that you do not know the difference between chief and chiefo.
The ouster of Dr. Wachira is seen as another admission to a failure on the part of the state in a very critical service. Ibrahim Karanja, NTV.
Well, the trouble at the Social Health Authority seems to be deeper than what meets the eye. Aside from the compulsory leave handed to the acting CEO, NTV has just learned that Dr. Zakayo Kariuki Geshoki has resigned as a board member of the Social Health Authority. He was the chairman of Strategy and Operations Committee of the SHA board. We shall definitely keep an eye on this developing story.